we got Tracy here, and we're going to talk a little bit about, you made the decision to do the gastric bypass surgery.
Right.
And what made you specifically choose that surgery as opposed to the gastric sleeve or some of the other options?
Well, I did a little research on my own, and I found out that by doing the gastric bypass, that is actually better for a type 1 diabetic versus the gastric sleeve. So I just felt, after speaking with you and speaking with my endocrinologist, that was the best way to go.
Yeah, that's what when patients come in, that is what we try to do, is individualize that decision. And there's no generic right one for everyone kind of approach. I think that's a bad way to approach it. There are certain things about each surgery that are treated better with that surgery, and some diseases, the remission rates are just higher with certain things, and those are kind of the things that we like to talk about when you come in and make that decision. In general, the recovery is the same, and the diet's the same, and the incisions are the same, but those specific surgeries, one can treat some disease like diabetes. Type 1 and type 2 diabetes are just the control rate with type 1 and the remission rates with type 2 are just so much higher with the gastric bypass. That obviously doesn't mean every diabetic has to get a gastric bypass, but we're going to have that conversation. And for you, it's worked great.
It's been a blessing for sure. And I would encourage people, especially if you have, two comorbidities, diabetes and hypertension or whatever, check with your insurance company, because I had no idea that my insurance company would cover my procedure.
Right.
And I've worked in the medical field for 30 years.
These things have gotten so safe that we're lowering criteria now. We're trying to catch people earlier and not wait till, you don't have to wait till the weight gets to as high as we used to have to require it, because you start looking at the safety of the surgery versus the risk of the surgery versus the risk of the weight, and when does that line get crossed where the risk of the surgery is low and the risk of the weight starting to far outweigh it? That's when you want to start considering something like this, and especially when you start getting those health issues. Those are some scary health issues to deal with. So let's go back to before we met, and how you got to the point that you decided you wanted to do this, and what kind of made you make that decision?
Yes, I know. I wish I had done it 20 years sooner.
I hear that every week. Somebody says I should have done it sooner.
But struggled my entire adult life with weight, no matter what exercise regimen I was on, or the different diets, the different medications, and it just got to the point where I needed to do something. And after having 5 total knee replacements and my mobility being limited, and then being diagnosed with type 1 diabetes, I'm like, okay, let's get this reined in.
Right.
And so glad I did.
Yeah, it's tough to lose it on your own. It's easy to say, well, let's go exercise a little bit more and eat a little bit better, and those are things we need to do, but that's not that. That in and of itself it's very difficult. When people struggle with weight loss, they really continue to struggle with weight loss, and it gets very, very difficult. So, and then the surgery that you chose to do.
I had the gastric bypass, and it was, for me, it was a breeze.
Yeah.
It truly was. I had 0 complications after. I was up the very next day, walking around, doing some light housekeeping work, and I had good energy level. I didn't struggle with nausea or anything out of the ordinary. I felt darn good.
Yeah, you've done really well with it. And we're still in your first year. We're not even
9 months.
We're only 9 months in, and how much have you lost so far?
I lost 58 pounds.
That's great.
So
that is fantastic.
Yeah.
That's fantastic. How's your diabetes going? And
I have cut back my insulin level by half.
That's great.
I am off my blood pressure medication.
That's great.
My energy level has increased dramatically, and just the self-confidence that you feel when you look good.
Yeah.
You know, it's the best thing.
Sometimes you don't even realize how bad you feel until you get some of that weight
Exactly.
off, and you're like, "Wow, it's all so much easier than I realized." I know how much it was bothering me until I really got it off.
Yes, that is true for me as well.
Well, you're doing great, and I'm really excited to continue to watch your journey.
Yeah.
We're still
Thank
just
you
in the
so
middle.
much. You've made a huge difference in my life.
You bet, of course.
Absolutely.
Good. Thank you.
Thanks.